I feel like I proselytize a lot about iteration and how it fits into software development. One thing that we've learned in looking at our competition, where there are about 450 EMRs out there, mostly with 10 or 15 installs around the country, but where each of them failed was mostly around taking a waterfall approach to building applications. So they would, and Hippocrates is a good example of that recently, they essentially held on to their product for about 3.5 years while they were developing on it, and then tried to deploy it, and nobody had any interest in it, mostly because it was a very daunting thing to take on this massive new enterprise software that had questionable value to their practice. So it wasn't enough for us to be web-based early on. We learned that. It wasn't also enough for us to be free. People had to know about us somehow, so there had to be some sort of viral, well, we don't use viral in healthcare, some sort of network effect impact, features within the application. But then also it had to be just a good experience, a good user experience, and just easy to learn and use. We've done a lot of A/B testing within our application on specific features, even after they've been out in the wild for a while, because we're not satisfied with some of the times it takes for doctors to see patients. Our goal is to minimize that as much as possible and take the computer, the interface out of the computer interface out of the equation, so that the doctors can focus on their human interfaces, so they can actually deal with their patients right there in the office, since the charting is happening actively while doctors are using our product. So we have deep UX and UI design baked into our development process. It's very iterative. We literally iterate on something 3 or 4 times, and then we call it good and we move on, and then maybe 9 months later we with a very analytical eye, look at what we had done previously with all the data points that we were measuring with click track heat mapping, just to figure out if users are using it as we expect them to. And a lot of times our users, because we're free, they want to help us. There's this built-in psychological aspect to the fact that we don't charge them anything, that they feel like they owe us something, so they're constantly giving us feedback. We have an advisory panel, that essentially doctor advisory board, that gets to help beta test some things. We didn't even hire anyone with clinical background until our 13th employee. And that was very intentional, because we looked at the rest of the EMR space and saw a whole lot of failure. So we did not want to follow that failure model, and it's worked out pretty well. This approach to what has typically been referred to as enterprise healthcare IT, where we've sort of flipped that on its head and taken a more Silicon Valley, agile methodology, startup approach, where we release a minimum marketable feature or a minimum viable product to market, and just let users give us feedback. That way we've made maybe a 3-week mistake on a product or on a feature rather than a 3-year mistake. And it's really made it where software development is like churning out pasta. It's just clean and crisp every time.